Pediatric eczema or childhood eczema or atopic dermatitis are all different names for the same condition. And it is very interesting as a pharmacist, as a clinician, as a mother. This is one of the very common inflammatory skin conditions in young kids and in children. In statistics, when you look at it, it's one of the most prevalent non-infectious diseases in the 21st century. It presents huge challenge for kids suffering with eczema, but also their caregivers, parents, and healthcare providers in managing the problem. What I'm observing as well, it has a huge family burden for the families that have eczema. Kids suffer because the skin is itchy and painful and inflamed. But parents also kind of feels almost guilty that the kid has eczema, and they feel almost really responsible for it. There is effect on quality of life, on sleep, on performance during the day, kids in school or daycare. And again, treatment burden can be very high. We have done studies with probiotics starting the intervention at a different age, early in life or even later in a childhood. And what is really encouraging is that the intervention of probiotics is not that they have to take it for the rest of their life. Most of the studies observe benefits even after 8 weeks of intervention. We usually suggest when we're using probiotics as intervention to maybe plan to take it for 12 weeks and then discontinue if no longer needed. Keeping in mind, you can always, if symptoms flare up, you can always go back on it. As a pharmacist, I tend to recommend 12 weeks of intervention with the probiotics for most of the interventions, especially for chronic issues such as pediatric eczema. So pediatric eczema or childhood eczema or atopic dermatitis are all different names for the same condition. And it is very interesting as a pharmacist, as a clinician, as a mother, to observe that basically this is one of the very common inflammatory skin conditions in young kids and in children. In statistics, when we look at it, it's one of the most prevalent non-infectious diseases in the 21st century. And the incidence of eczema is actually growing. It presents huge challenge for kids suffering with eczema, but also their caregivers, parents, and healthcare providers in managing the problem. Pediatric eczema has a very heavy social and economic burden because of the growth of prevalence of eczema and incidence of eczema, and also because it's a chronic and relapsing in nature, so it kind of settles down a bit and then comes back again and settles down and flares up again. And what I'm observing as well, it has a huge family burden for the families that have eczema. Kids suffer because the skin is itchy and painful and inflamed, but parents also kind of feels almost guilty that the kid has eczema, and they feel almost really responsible for it. There is effect on quality of life, on sleep, on performance during the day, kids in school or daycare. And again, treatment burden can be very high. Parents change their lifestyle around kids' eczema, what they use to bathe the kids, how and when they do it, what kind of cream they use, skincare. On average, I'm finding and learning about the parents being involved, spending 3 hours per day actually just caring for kids' skin in different ways, whether changing diet or really putting applications on the skin, etc. So it's lots of time spent managing kids with eczema. So a few things about eczema is also interesting, that it's a very complex issue and involves different things. It involves the genetic factors from the parents and their families. Environmental factors have a huge impact. And also immune responses or immunological factors play a huge role in risks and when and why child will actually develop the eczema. What we are finding with kids that has the pediatric eczema, they present skin that is dry. Most of the time they have the itch, and they quite often scratch and itch in different parts of the body can be affected. And quite often those more sensitive parts, their skin is thinner, there's maybe more moisture and it creases as well. And then there is a breaking of the skin that cars over and has a bit of a flaky, kind of almost like a tough feel when you touch it. Sometimes there are bit vehicles and papules on top of the skin, which could be even fluid filled with a bit of a leaking of that fluid, but then it dries up and then skin starts breaking and fissuring, promoting and opening the parts for the infection. So then everything might calm down a bit and then flare up again. So it's really present in different ways and presents from very early age. So pediatric eczema occurs since the birth. So immediately after birth, and as the baby is developing early in infancy, we will start seeing the symptoms and they can get progressively worse throughout the childhood. Some kids will actually grow out of it at some point, but 10% of them will actually continue carrying that same skin condition throughout the adulthood. Sometimes you observe eczema, we call it eczema, but it could be dermatitis in adults that never had childhood eczema or pediatric eczema. So that could be caused by different factors and different issues. But at this point, we're talking about pediatric eczema that is something that to do with the basically immune responses of the child, because we are now finding there is a connection between the immune system and how immune system learns how to respond to the environment or the things that we eat, because we are finding there is a connection between gut microbiota to skin microbiota. And then we also find that, for example, maternal diet during pregnancy and maternal microbiota will actually send messages to the baby in utero, in fetus, and might kind of pass that bad messaging or good messaging to the baby even before it's born. We're also finding that kids that are born by C-section might have higher risk of developing childhood eczema versus kids born by vaginal birth. We do know that there is a difference between the speed of populating the gut with microbiomes in the kids that are born C-section versus vaginal birth. Those with vaginal birth populate the gut much faster with the diverse microbes, and their immune responses are better in a way than kids born with a C-section. The prevalence of use of antibiotics during pregnancy and infancy will be huge risk factors for developing eczema. That is another factor pointing there is a connection between gut microbiota diversity and developing eczema early in life. Our Western diets do not support diversity in our gut, so they are always risk factors as well. Exposure to allergens. We are also finding that kids born and living in urban settings are at higher risk of developing pediatric eczema. Exposure to air pollution is also a huge risk factor. So those are kind of things that kind of led us to find out that the pediatric eczema is actually connected to the baby's immune responses. We also are observing that kids that develop pediatric eczema will also develop quite often allergic rhinitis or a bit of an allergy runny nose or allergic conjunctivitis, which is the swollen and runny eyes. But then they might also develop the food allergy, even anaphylaxis to different food, and progressing to asthma. That means the breathing airways will actually start being inflamed or reacting. It's called atopic triad or atopic march. That means really kind of almost one glitch in immune responses can lead to another and to another. So it could be presenting fairly complex issue. So childhood eczema or pediatric eczema is diagnosed by a physician, and there are different kinds of procedures that we do, basically assessing by look and feel the skin and other symptoms that the child might present. And there are different tools that the physicians use to actually assess and see how severe the presentation is. Those are things that not everybody needs to know about, but they're called SCORAD or severity score for the physician to assess and document. And there are some other eczema area and severity index, which means how many parts of the skin or the body are and what portion of the skin is affected and how severe presentation of symptoms are. The reason why we do that is if we do any intervention for it, we like to see the improvement and measure improvement. So basically what we look at, what symptoms, how large area is affected, how frequently they come back, and then assess how they would actually react to any intervention. As I mentioned, we not only look at the skin with the pediatric eczema, we look at presentation of other symptoms that might present, like allergic rhinitis, because 2/3 of the kids with pediatric eczema will develop the runny nose. That is not connected with a cold or other viral infections. Some of the kids will actually, half of the kids with the eczema will have a risk of developing allergic asthma. So those were symptoms that we would address and assess when assessing kids with the pediatric eczema.